This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Of monkeypox in a Clark County resident. The individual is a male in his 20s with recent domestic travel history. He did not require hospitalization and is isolating at home. To protect patient confidentiality, no further details will be disclosed. We are coordinating with the Center for Disease Control Prevention to perform confirmatory testing, as well as investigating and conducting contact tracing related to this case. No additional cases have been identified at this time. Based upon the information we have at this time, the overall risk of monkeypox is low. People with unknown rashes or lesions should contact their healthcare provider for an assessment and avoid sex or being intimate during that time. Those at risk for monkeypox include people who recently traveled to other countries, had close contact with someone who has monkeypox in a social network, including meeting partners through online websites, digital applications, or social events where monkeypox infections have been reported. Monkeypox spreads from person to person through close physical contact with infectious monkeypox sores, bodily fluids, contact with objects or fabrics that's been used by someone who has monkeypox, sexual contact, or prolonged face-to-face contact. People with unknown rashes or lesions should contact their healthcare provider for an assessment and avoid sex or being intimate or close during that time. I'll now open it up for questions.
If anyone would like to ask a question today, please raise your hand. Our first question is from, oh, by the way, when I call on you, I will unmute you, and please ask you to state your name and your media outlet. First up is Victoria. I'm unmuting you now.
Hi, I'm with Channel 8. So what else should the community know? Because it seems like it might start out like, a fear factor thing like we had with COVID, where it was just one case and, another one popped up. So what should the community know?
I think it's important to know that the community risk is low at this time. The transmission route is different than COVID. It is with close skin-to-skin contact or prolonged face-to-face exposure. So at this time, our community risk is low, but something that we should be aware of.
Next question is from Lauren. I'm unmuting you now.
Excellent. Lauren Clark here, News 3. Thank you guys for having this press conference here. Do you mind explaining just in a little bit more detail about how this differs from COVID? We know that this has been around for quite some time, and there's ways to treat this. Can you explain that a little bit for our audience to put that into perspective?
Yes, the primary route of transmission is what is a major difference here. It's skin-to-skin contact, and primarily through those lesions or rash or sores. So someone with an open lesion, a monkeypox lesion, has very infectious fluids within those lesions. So that close skin-to-skin contact or close hugging, touching is really how we see this be transmitted from one person to another. So quite different than what we see in COVID.
In our chat, we have a question from Yvette Fernandez. She's asking, so is monkeypox mostly a sexually transmitted virus?
No, primarily this is transmitted through close physical contact. Now, that said, sexual activity involves close intimate contact. We do know that this is transmitted through bodily fluids. So kissing, intimate contact can be a route for transmission, but also just skin-to-skin contact with someone who has a lesion can lead to transmission.
And our next question is from Mary. I'm unmuting you now.
Good afternoon, and thank you. Are you expecting to see additional cases in Clark County, and how can people protect themselves?
That's a good question. We are seeing this outbreak, this national outbreak, spread from state to state, and numbers increasing as the CDC monitors this on a national level. Because we have folks who do travel frequently, it would not be unexpected to see another case. However, we're doing our best to do contact tracing isolation and close contacts around the nation to prevent further spread. To answer your second question, what precautions we can take is really just to be up to date on what a rash looks like. Should someone experience symptoms, fever and rash, to contact their healthcare provider right away.
Thanks.
Our next question is from Fox 5. When I unmute you, please identify yourself.
Thank
Go
you.
ahead.
This is Elaine with Fox 5. What should someone expect symptom-wise if they get monkeypox? And is there any known treatments right now if someone tests positive?
Thank you for your question. Primarily, almost all cases who are infected with monkeypox develop a fever and rash. So the fever is the triggering symptom to watch out for, particularly if you have been in close contact with someone who was diagnosed with monkeypox. The fever followed by the rash are your primary symptoms. There can be some swollen lymph nodes involved and general kind of ill feeling, but those are the primary symptoms that one would watch out for should they have an exposure. Can you repeat the second part of the question? The treatment, I'm sorry, it came to me. Currently, there is a potential for a medical countermeasure or treatment for someone who has become infected, who is at high risk for hospitalization. That would have to be coordinated through the local or state health department and the CDC. The treatment that is available can be read upon on the CDC's website, but it's more specifically related to smallpox, which is in the family, the same family of viruses as monkeypox.
Next question is from Lauren Clark. I'm trying to unmute you. Hold on. There you go. Go ahead, Lauren.
Hi there, Lauren Clark again, Channel 3 News. So this is a presumptive positive case at this time. How long will it take for that to be official?
So what happens is the presumptive positive samples do get sent on to the CDC for confirmation testing. We're hopeful to get that answer in the next 48 to 72 hours. It could take a little bit more time depending on the shipping and the lab availability at the CDC.
Okay, we're going to take a follow-up from Fox 5. Go ahead.
Thank you. What is the Southern Nevada Health District doing right now to prevent potential outbreaks or potential additional cases of monkeypox going forward?
So the primary intervention for this particular infection and this particular outbreak is to ensure that the person who is infectious is isolating and that they remain in isolation until they are no longer infectious. That varies depending on the progression of the disease. So we'll be in close contact with the person to ensure that they remain isolated throughout their infectious period. Additionally, if we were to identify any close contacts here in Clark County, we would monitor, be in touch with that person, ask them to take their temperature twice a day for a full 21 days so that we can monitor closely and be of assistance should they become symptomatic and prevent further spread.
If anyone has not yet asked a question today but wishes to do so, please go ahead and raise your hand. We do have a couple more follow-ups. First up is Mary. Go ahead.
Thank you. Kimberly, can you explain a bit what a presumptive positive means? I mean, what test you did to determine this is a likely case, and then does the CDC just repeat that test, or how does that work?
Thank you for the question. I'm not a lab expert, but I can talk generically about the testing process. So local public health, state public health labs can determine whether or not the sample, so the sample coming from the lesions itself, is part of the orthopox virus family. And in addition to the orthopox virus family, what's taken into account is the clinical presentation of the lesions as assessed by the physician. So in addition to the presentation of the lesions with the positive orthopox virus initial lab, then that goes on to the CDC to be confirmed by DNA.
Once again, if anyone has any questions, please go ahead and use the raise hand feature. At this moment, I don't see any raised hands, so let's give it just a second. And then, oh, there we go, Victoria.
Hey, yeah. Can you tell me if this individual had gone to like an urgent care hospital with these symptoms and was tested right away, or did he have to wait a few days to see if it got worse?
I don't have any of the details about the first visit. What I do know and what I can tell you is that the person is not severely ill to be hospitalized. So the diagnosis and assessment did come from an outpatient facility.
Thank you for everything today, Kimberly, and thank you all for joining us. Thank you for getting this information out to your readers and viewers, and have a wonderful afternoon. We'll wrap it up. Thank you so much, everyone.
You've been watching breaking news
Thank
from
you,
the Las
Corey. Thank
Vegas
you.
Review Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.